Good morning. Okay, let's just test it first. Uh, test, test, test. Okay, do you hear me? Test, test, test. Okay, do you hear me? Test, test, test. Perfect. Everything is okay. So, today is Saturday, July 22nd, 2023. This is our regular Saturday morning yoga therapy class. And as you know, this class is based on our teaching experience and the experience of all the patients who have been doing yoga therapy with us. And this is also a request. When you request yoga therapy for various ailments or conditions, we try to do it too. So we have been presenting for last few weeks the balances, the Parkinson disease. In the same line, we got a request for yoga therapy for peripheral neuropathy. It's a very common name, and it is very well integrated into our vocabulary now. So peripheral means at the outside, at the tip. Like a peripheral means your hands, your feet, in the leg, in the hands and arms. And neuropathy, neuro is a nerve, pathy is a pathology. Some ailments or disease in your nerve. Peripheral neuropathy, obviously, in the same line of therapy we're talking about, yoga therapy for bringing balance, yoga therapy for Parkinson's disease, yoga therapy for, say, multiple sclerosis. First of all, a peripheral neuropathy is an aging process. I don't know what aging means, but let's go over the pathophysiology of the disease before we show you the practices. Aging is a process which is primarily a physiological, and in yoga therapy it is also a mental. Chronological age, that means number has no meaning. The physiological age obviously is determined by the functions of the organ, but these days is also seen by the length of the telomere. Telomere is an organ in the mitochondria. When you're aging, the length of the telomere goes down. Practice of yoga therapy has been shown to increase the length of the telomere. That means yoga therapy practice is anti-aging. No question about it. People are practicing yoga and yoga therapy. They look younger, they function younger, and they also act like a very young person. You'll see the people doing yoga, they will always mix with the younger crowds. Their thought process are like a younger people, and they don't like to be hang around with the so-called seniors, or experienced. We don't age anymore. We get younger every day. The primary cause of peripheral neuropathy, as you said, It's a degenerative change of the covering of the nerve. The covering of the nerve is called a myelin sheath. Metaphorically, you will see that, say there is electric cable, okay? So I'm looking for electric cable. Electric cable, the cable is inside and there is a coating outside. Same way, there is a nerve fiber which goes a peripheral nerve and is a covering called a myelin sheath, and myelin sheath is produced by a nerve called the oligodendrocytes. So the primary cause is the ischemia. Ischemia means lack of blood supply to the covering of the nerve called the myelin sheath. The nerves are also supplied by a small blood vessels. In blood vessels, we call it vasa vasorum, and it is also equivalent to vasa vasorum for the nerve. The blockage in the arteries, which we call an atherosclerotic disease, which you see in our heart, in the coronary arteries, on your leg blood vessel, in the carotid arteries, also happens into your small blood vessels. So the metabolic syndrome, which constitutes today diabetes, hypertension, coronary artery disease, your dyslipidemia, that means abnormal lipids and high cholesterol. Dyslipidemia basically includes your high triglyceride and low HDL and the truncal obesity. So the metabolic syndrome, and primary of the metabolic syndrome is diabetes. People with diabetes gets a peripheral neuropathy. At this time in our medical practice, we see a lot of peripheral neuropathy with the people with a cancer and receiving chemotherapy. People receiving chemotherapy are developing a large number of peripheral neuropathy. Cause probably is toxic, or we have other explanations, but primarily we think it's a chemotherapeutic toxic which is causing peripheral neuropathy. Next important cause is autoimmune disease. Autoimmune disease means our immune system thinks that the covering of the nerve sheath is a foreign material, a foreign substance, and it starts fighting against it, start digesting it, and develops peripheral neuropathy. A compression of a nerve, like there is the lateral popliteal nerve on the side of your head of the fibula, in the neck, it can compress and get a peripheral neuropathy in the distribution of lateral popliteal nerve. Also, even in the, say, back pain, when you get a compression or irritation of a nerve through a herniated disc or a spinal stenosis, you may develop peripheral neuropathy down the leg and the feet. After an injury, if there is an injury to the a nerve, and when the nerve also regenerates, peripheral nerve regenerates, that means it grows back, they develop peripheral neuropathy. Another very important compression is called the carpal tunnel syndrome. Carpal tunnel is a median nerve going underneath the tunnel. There is a fascia covering called a tunnel, which is called carpal tunnel, causing the symptoms in your hand. Metabolic causes can cause it. Other important is your folate, the vitamin deficiency. Folate is a B6, vitamin deficiency, which causes neuropathy. So there is a lot of other conditions, but primarily you see your aging process, diabetes, cancer and chemotherapy, autoimmune disease, inflammatory disease, some of the inflammation, like your Lyme's disease, your shingles, herpes, many of the time HIV, the virus, the inflammation can cause peripheral neuropathy. The first and foremost symptoms will be a numbness in your under surface of your feet, and with this numbness you will be able to feel what you are having, and you'll get a loss of balance. So our presentation, the yoga therapy to bring balance back, is very important also for peripheral neuropathy. Then after the loss of sensation will be the pain. And the pain is all a different kinds of pain. Pain will be sometimes very mild, like it may be just a needles and pricks, or sometimes like a lightning. Suddenly the pain will start is like a lightning. I see a lot of my friends who complain about peripheral neuropathy. Another pain will be constant pain, constant like a burning pain. Feels like you are stepping on a fire or on a bed of charcoal. Other sensation is a hot and cold, alternate hot and cold sensation, and many a time you may have even a muscular weakness. And we believe this whole thing is primarily due to the tightness, what you call the tightness of the blood vessels, causing lack of blood supply, called the ischemia. Tightness in your, the ligaments, the muscles, and the peripheries. So primary therapy again is a relaxation response. The moment you'll be able to do a relaxation response, you'll be getting better and better in peripheral neuropathy. Second, exposing the organ, especially the feet, the plantar surface of the feet with the ground. So what does it mean? That means one of the primary therapy we recommend is walking barefoot. Walking barefoot is absolutely important, and primarily you will see we want you to walk barefoot at home. At home, we like you not to wear a socks or a sandals. And in the outside, if you want to walk, which will feel like a barefoot, maybe I can show you something. Okay, just give me a minute. I will show you what will feel like walking in a barefoot. And these are called yoga socks. I'll show you all of them. I'll show you how you can walk in a barefoot, and how can relax your all the organs. So here it is. These are called yoga shoes. The name is called Vibram shoes. It has been there for a long time. I have it for this maybe my third or fourth. I walk outside with this. In fact, I also do my my walking, my treadmilling, all wearing these shoes. And essentially, it just all the toes goes inside. And I'll show it to you how to wear it, and when you show the practice. So walking barefoot is one contact. Second, in a yoga practice, you put a pressure on your feet for like your carpal tunnel, your relaxation in your hand. As you know, your hand gets relaxed with a Adhi Mudra. or Balo Mushti Mudra. Put a thumb inside and close, and you do it a breathing. Breathe in, breathe out. Breathe in, breathe out. And essentially, when they're all relaxed, the fingers will go in and out, hands will get relaxed. You know, when they're not relaxed, they're very tight. Same way will be for your toes. So asana like your say thunderbolt, Vajrasana, sitting on your feet. Ustrasana, your camel pose, or standing, Utkatasana, like chair pose, put it down. Or you do a Trikonasana, triangle, or Birabhadrasana, warrior. Or you can do the sit-ups with a bellows, Bhastrika Pranayama, sit-ups with the Bhastrika Pranayama. And these are again, remember, these are the same practices which we do for our daily practice, and we just pick and choose for different diseases. Since yoga therapy is holistic, what we recommend, you do your daily practice, then based on your underlying clinical condition, you do a little bit more pick and choose. Okay? Then your, say, a primary pranayama for your peripheral neuropathy will be your alternate nostril breathing, Anulom Vilom Pranayama. Then will be your Brahmri Pranayama, bumblebee breathing, and then you call it Murcha Pranayama. It's called your feeling like you are passing out. You're so relaxed. Okay, let me start with. Let me go down to the mat so that you will be able to see it better, especially the one I'm going to show it to you. Okay, so let's bring everything up a little close. First, you need to learn how to relax your toes and your feet. Remember, your feet also has a arch. So a foot, what it is, if you look at it very carefully, so if I can show it to you here. So first of all, we'll be separating these toes. When you separate these toes, the front part gets a little bit of a wider, and then you get an arch support. And the way we do it very simply is that take the foot and slowly take our hand and we insert in between the toes. Initially, it will be very tough, very hard. You won't be able to do it, but once you relax, your fingers will go easily. It will go easily from this side, and it also will go from other side. We'll put it from the other side. Look at from the other side, all the fingers are separating our toes. And this is a everyday regular practice, and even not that, you're doing both sides. It's the other foot. You are doing from the one side here, and you do from the other side. In your daily practice, what you do when you sit down, let me see it here. When you sit down in your daily practice, you can do, we can bring one, I think you'll be able to see here. In my daily practice, what we do first, we'll sit down in a Dandasana, then we slowly relax our toes. So the first, we separate the toes with the breathing. We breathe in, we separate our toes, just the toes. Breathe out, we just bend it down. Breathe in, breathe out. We keep our eyes closed, breathe in, breathe out. Just look at the separation of the toes and then flexing it, bending it down. Separation of the toes, bending it down. Relaxation of the ankle is very important because ankle is the carrier of all the body weights. So you breathe in, breathe out. Breathe in, breathe out. Then you can breathe in, you can rotate your feet. Breathe in, and breathe. Always do the breathe. I get so many questions all the time. How do I do? When do I breathe? When do I breathe in? Where can I? You always continue your breathing during asana practice, and always remember that your breathing has to be effortless, as if it's a normal breathing. The best way to remember is our muscles will need oxygen. So before a muscle contracts, you breathe in. So when I rotate my foot, that is my muscles are working. So muscles are working to rotate my foot. So here, first I breathe out first in yogic tradition. Take a deep breath in. During breathing out, I will do the rotation. So breathe in, breathe out. So if you remember that, there will be no confusion at all. Also, you can do what is called a windshield wiper, a very nice windshield wiper. Then you relax the whole lower extremities. It's amazing how you feel and how you can get rid of your peripheral neuropathy. You do a Paschimottanasana, seated forward bend with separation of your toes. These are from our experiences. You won't see this thing in any book or any yoga tradition. So you put your fingers slowly, separate your toes. You see this? My fingers are separating all my toes. Now, keep my spine straight, eyes closed. Breathe out first, take a deep breath in, and slowly come down in my seated forward bend, Paschimottanasana. Then, for our knee and hip relaxation, put our foot high up, take our hand, put it again in between the toes. Take the knee, breathe out first, Breathe in and breathe out. Let it go all the way down to the ground. Don't push it down. If you push it down, it'll come back high up. It'll go down on itself. It's a phenomenon of neuroplasticity. Just stay where you are. Close your eyes. Do your breathing. Breathing out longer than breathing in. Breathing out is parasympathetic. Breathing in is sympathetic. And this is also the practice we do throughout the whole day. I'm sitting in a chair, I'm sitting in my sofa, on my barefoot. Obviously, we walk at home all barefoot. And then, same thing I will do. My hand, put my hand in between the toes, separate my toes. It is so easy for me to go in and out of these toes, toe separation. Take the knees again here. Breathe out first. Take a deep breath in and breathe out. We'll go all the way down. It's a wonderful feeling, you just breathe in and breathe out. And my hand is here. Many a time. Also, I'll do lotus pose. See? Padmasana with the separation of the toes. I'm in the lotus pose. I have both the hands are in between the toes. Again, sitting down this, we'll be doing our pranayama practice. From here, you can do Kapalbhati pranayama. What it does, Kapalbhati pranayama is relaxing. Kapalbhati pranayama quiets down your mind, and also you're relaxing your toes. Or separating toes, you can do a Bhastrika pranayama. And you can feel that when you do pranayama, the things are getting more and more relaxed. It's amazing, how you feel the immediate effect of it. This is called, what is meant by yoga therapy practice is called experiential. You feel it when you're doing it. And especially, we being a physician, we understand the physiological changes is happening in our body and mind when you're practicing, yoga therapy. You can also do your Baddha Konasana, like seated, put your feet together, keep it here for a while. So if your knees comes down, you can do, it's called your butterfly, Titliasana, and slowly, again, remember, in stages, impossible become possible. And slowly you bring it close to you. You will feel the sensations will start coming. It may not come right away. It might take some time. And then essentially your heel will come all the way to your perineum. And then keep your spine straight, eyes closed. Keep doing the Titliasana, butterfly, and you will see slowly and slowly your knees will come towards your ground. And again, you can feel that if you're staying in this posture, that your knees are slowly and slowly coming down. Now, our West is a consumer-oriented market, so we have a lot of gadgets. There are gadgets a lot of gadgets are in the market for your toe separation. Toe separation, what are the other things in the market? Toe separation, arch support, wider separation into the back. These are called your yoga toes. Basically, it's a toe separator and made of very soft, pliable material so that you will be able to even walk or even sleep with them. Where is this? Okay, it's called your yoga toes. So, what is this? Here it is. Yoga toes. You have your foot, then you put the separator goes in between the toes. And sometimes if you wet it a little bit, little water helps. Can you sit down? The toes are all separated. It's so soft, you'll be able to walk, you'll be able to sleep. Initially, it will be little discomfort. That's okay. As long as there is no pain, you will be able to function. So, we always do a balance in both sides. So, put the one in the opposite foot. This is my right foot, left foot. You can see this. It's a wonderful, these are very soft, jelly-like material. So you'll be able to even walk, or even you'll be able to, so you can see, I'm sitting with it, I'm getting up, and I'm sitting down, and I'll be able to sleep with them. Here I am. What a wonderful, wow. This is called relaxation. You're in a savasana with the yoga toes, and also maybe sleeping throughout the whole night. Turn on your left side. Slowly you get up. Now, to progress, I have a lot of this toe separator for people with your peripheral neuropathy. Yoga socks. Put it here. Same concept. There is a socks with a toe separator. See that? Right foot. And also you get into your left foot. It's amazing also. So many of my friends are started complaining of peripheral neuropathy. And as I said, one of the side effects of our very famous therapy is a cancer chemotherapy. Left foot, right foot, and you can see the separation of all the toes. Very nice when you walk around. And a lot of people ask me, where do you get these gadgets? You know, where do you get it these days? You name it, you'll get it. There's only one website who will have all this stuff. Amazon.com. Next is yoga sandals. Let's see if I have yoga sandals. Yes. Yoga sandals, again, there is a separator, toe separator. Actually, in fact, this is nothing that when you go for your pedicure, you will get this, they get a toe separator. They will get it for, so if you look at how it will look like, it will look like this, that these are beach sandals. So put it on in the left, you also put it on your right. Left one and the right one, and you can see both of them. Toe separator. I've also shown you the yoga socks, yoga shoes, which we use in during walking, and also I use it during my treadmill exercise. So here you put your, again, put your all the toes inside, and this will look like this. All of your toes are separated. Left foot, right foot, so you can see these are toes. If you incorporate this in your lifestyle, day-to-day practice, you will have a wonderful relaxation of your feet and the lower extremities. Another one, I used to be using it in the operating room when I was standing for a long time. This is a traditional Birkenstock. You can see it is very wide in front and there is a nice arch support. So our feet is not flat. Flat foot also causes peripheral neuropathy. So when you get an arch support and when you put both of them together, you will be able to see. So these are the two shoes with wide in the front. So what is very harmful for our feet is these pointing shoes, which the women is wearing. So I'm teaching the women, so try not to use the pointy shoes and not to use the high heel for day-to-day walking and day-to-day living. Yes, you have a party, you are dressed up, you want to do a little pointy shoes and a little high heel, is okay. What the other says that it's a daily practice what you do that affects your health and wellness. Something occasional doesn't do anything. Another one is called a pressure point in the foot. In yoga therapy, is called your marma points, which you call acupressure. And Chinese medicine, you're talking about acupuncture, also acupressure. This is a shoe which I had for a long time. Inside has all the pressure points in the sole. So I'm wearing it. It is selectively pressing my acupressure points. Let me see how many I have. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Yeah, 5 acupressure point. And this is also a pair of shoes you can see. A lot of people ask me, who's manufacturer, everything. I said, I really don't know who's the manufacturer. I got it some time back, and it looks like a German name, von Wellix. Yes, it is a German. I can tell you, VONWELIX, Germany. Yeah, 5 reflex zone bed insole. So there's a 5. Yeah, it says 5. Okay, let me show it to you more closely. So you might even order it. So let me see. Go to one side now. Here it is. Now you see, I'm seeing, we put it in the middle. 5 zones, von Wellix, 5, what it says, reflex zone. Okay, enough with all these gadgets, okay? Daily practices, as I said, that you can put a pressure on your on your feet. Okay, putting a pressure on your feet will be first, say, come a little bit in the front so you can see a little bit better. Vajrasana, thunderbolt. You can fit here, sit down here. You'll get a nice pressure in the front of your feet. Then you can slowly separate your feet and sit down on both of your feet. And keep your spine straight. Can get up into a Ustrasana, camel pose. Feet, put your hands here. Slowly drop your hands. Push your body in the front and hit the back. Malasana, squatting pose, is another one. A very wonderful relaxer of your feet, lower extremity. It relaxes it. First of all, it's touching your ground, relaxing your ankle, knees, hips, even in your hands. Put your elbow inside, separate your fingers in your hands, extend your wrist, keep your spine straight, eyes closed. Breathing out longer than breathing in, effortlessly, as if it is your normal breathing. What else to put your support on your feet? Okay, so when you're doing the downward facing dog, okay, also Mukha Svanasana. The trick is that when you have your hand generally is in a width of your arm, feet goes high up. When the head comes down, but then instead of feet being up, you put the feet all the way to the ground. You see that? Feet goes all the way to the ground. And from there, if you do upward facing dog, you do your yogic push-ups. Go all the way down and come all the way high up. But keep your feet down in the ground. Standing up, there should be a lot of stand-up asanas where you can have all the pressure points gets activated. Balancing poses are a must for your peripheral neuropathy because you start losing your balance. So we did all the yoga therapy for better balance. We did the week before. So you can go back, either you can go to the Facebook or you can take a look at my YouTube channel. But basically what it is, standing on your non-dominant foot and close your eyes. If you can stay on your non-dominant foot, at least for about 30 to 40 seconds. So very, very important, closing your eyes. And it's a very difficult initially. Closing your eyes and stay in the non-dominant foot. I'm right-handed, right-footed, the right foot. You can do even a tree pose. You do a tree pose. And then you incorporate Kapalbhati Pranayama. Utkatasana and your Uttanasana. Utkatasana is a chair pose, like you have separate your feet, have your hands in the front, and slowly come down as if you're sitting in a chair. And slowly get heavy. See, more you do that, more contact and the pressure you will have in your feet. Put your feet together. Padahastasana, hand touching your feet. You slowly come down, touch your ground first. In relaxation, your head will come down and head below your heart always does a relaxation. Hand goes to the sides. You are more grounded, more pressure. You can put your hand in the back and slowly bring your head touching your knee. Regular practice, we stay in asana pose between 5 to 10 breaths. What else? Okay. Prasharito Uttanasana with Kapalbhati Pranayama. So keep separating your feet. More you separate, more grounding you are getting. And when you put your head down below your heart, a relaxation response sets in. Why? When you put your head below your heart, your pressure inside the brain, called intracranial pressure, goes high up. Pressure inside the eyes goes high up. Pressure inside your carotid arteries goes high up. You're miserable. The whole head is flushed. Eyes may be watering. But if you keep it down, slowly and slowly, neuroplasticity comes in. Baroreceptor sensitivity comes in. Your intracranial pressure comes down. Intraocular pressure comes down. Intracarotid pressure comes down. And you enter into a wonderful state of relaxation. Feet are grounded. Let's see. My head will come and touch the ground. Hands touching here. And you're doing a Kapalbhati pranayama. Wider your stance is better for your grounding sensation. Prasharito Uttanasana with Kapalbhati pranayama. Same way, like your Trikonasana, triangle pose, or Virabhadrasana, warrior. A little bit in front. Then you can do your little bit less space. Anyway, so let's to keeping in your camera, maybe, oh, you guys know these asanas, you know, the Trikonasana. Again, just to show you that you put your feet this side and then do it in stages, like put your hand down, slowly, hand will come down. Take this hand, slowly go high up and all the way high up, and your body will go all the way to the back. It is amazing if you start doing it against a wall. If you're against a wall, your body will be in a perfect triangle pose. You can do it. We call it reverse triangle, Viparit Trikonasana. Yes, not enough space here. Anyway, so it's hard to do in a small space. So you got the concept. Relaxation of the toes, hands, wrist. The wrist gets relaxed with the extension, gets tight and flexion. Breathe in, breathe out. Balance to the other side. So pandemic has pushed us to do everything virtual, but we need enough space, enough. This leg should be straight from here. Hand goes high up, all the way high up, straight high up. Then your body goes all the way to the back. Okay, I think enough with this asana for your peripheral neuropathy. And as you know, these are all basically also anti-aging practice. Pranayama, most important pranayama, as we're doing all the time, is breathing out longer than breathing in. Lung is like a balloon. It has 6-liter capacity. It needs 1.5 liter to keep it open. We have 4.5 liter, which you can exchange, called vital capacity. And what you exchange, called tidal volume, is only half a liter. 500 cc. So 80-90% of this reserve. So breathe out first, slowly breathe in, and slowly increase the amount of time. If you get count of 2 in, the 2 seconds, count of 3 in, 3 seconds, like 1 and 2 and 3, and then breathe out, count of 5 or 6, and do it effortlessly. Muscles of respirations are skeletal muscles. They can be trained, and you can always do it, and we have always shown it to you how to do it. Have your Dhana Mudra, Jnana Mudra, keep your spine straight. Breathe out first. Take a deep breath in. Breathe out longer than breathing in. You will develop some saliva in your mouth. So I've been talking to you for probably over an hour, and my mouth is still wet. I have a saliva in my mouth. There's a parasympathetic activation. Alternate nostril breathing with a balance. You all know how to do alternate nostril breathing. You close you do your one Dhana or Jnana Mudra. Close your right nostril. Breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril with the ring finger and little finger and breathe out through your right nostril. Breathe in through the right nostril. Close your right nostril, breathe out through left nostril. Bring the more concentration, put your index finger and middle finger in the third eye, in between eyebrows. Take the left hand and hold your right earlobe. The super brain yoga, concentration. Now you continue alternate nostril breathing. Left nostril is controlled by the right brain. Right brain is intuitive, right brain is female, right brain is parasympathetic, right brain is cooling. Left nostril breathing is called your Chandra Nadi or cooling, moon energy. Right nostril is controlled by the left brain. Left brain is analytical, left brain is male, left brain is heating, left brain is sympathetic. Right nostril breathing is called Surya Nadi, sun energy, sympathetic. Activation of both sides of the brain. Continue your pranayama until you have a little effort in breathing. If you don't have any effort, you do it for 5 to 10 minutes. Our daily practice, we do 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. Quieting down the mind, primarily, stress. Stress is a fear of unknown. Stress is a sympathetic overdrive, and stress is a vasoconstriction. The blood vessel gets constricted. Constriction of the blood vessel, a reduction of the blood flow is the root cause for all of our ailments in our body. Vasodilatation, dilatation of the blood vessels. Endothelial health, proper function of the inner lining of the blood vessel are the most important element for health. So our body has a vibration, brain has a vibration, body has a vibration. We create another vibration. So two vibration interacts, cancels. It's called your harmonic resonance, Bhramri Pranayam. Shut down your five senses, because activation of five senses is our mind, and the mind is called Chitta Vritti, activation of your mind, and yoga therapy is a Chitta Vritti Nirodha. Index finger in your forehead, you can use a Shanmukhi Mudra, or you can close your eyes, close your ear, and close your mouth. Breathe out first, take a deep breath in, and breathe out with the sound of a bumblebee. Pumping and cupping, keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hands, if you're wearing glasses, remove your glasses, then put your hands over your eyes like a cup. Let the eyes take all the heat from your hand. The heat will relax your ciliary muscles. It will reduce the convexity. It will increases the convexity of the lens, acts like a reading glass. Relaxes of thy muscles. SO4, LR6, superior oblique muscle is supplied by the fourth cranial nerve. Lateral rectus muscle is supplied by the sixth cranial nerve. Retina is supplied by the optic nerve, and the outside is supplied by your trigeminal nerve or a fifth nerve. Massage your forehead, massage your face. All the muscles here are attached to the skin. By the time these muscles are relaxed, your skin, all the lines goes away, frowning goes away, skin marking goes away. Slowly take your hand, massage the earlobe, behind the ear, in front of the ear. In fact, put your finger inside the external auditory canal and massage. You'll see when you really massage a little bit of the external auditory canal, you feel a relaxation response, because there is a auricular branch of the vagus nerve. So vagus activation, bring your hand, massage your carotid sinuses on the side. Carotid sinus massage helps quieting down your cardiovascular system and nervous system. You do a carotid sinus massage during supraventricular tachycardia. Take the hand and massage in the back, in occipital tubercle, where you have insertion of the sternocleidomastoid muscle and trapezius muscle, both supplied by your cranial nerves. Murcha pranayam, murcha means unconscious. It is so relaxing, it feels like you're almost unconscious. The mechanism is your breath holding in inhalation, called Abhantarin Kumbhak, with your chin lock. Chin lock is called a Jalandhar Bandha. So what it does, when you breathe out first, take a deep breath in and hold your breath, your lungs slowly start to expand because the air is not coming out. And then when it comes to the periphery, where there is a bony cage, then it cannot expand anymore, then it's a recoil back. When it recoils back, it starts a reflex called a Herring-Brewer reflex, which is activation of your vagus nerve. So it is a vagal activation, a relaxation response, parasympathetic activation. Chin lock, on the other hand, also massages your carotid sinuses. So your carotid sinus massage with the vagal activation, oh my God, it's a wonderful, wonderful relaxation response. Dhyana mudra or Jnana mudra. Breathe out first. Slowly take a long breath in. Hold your breath. Drop your head down in a chin lock. Bring your chin down close to your chest. Hold your breath. Keep counting. 1 and 2 and 3. See how long you can hold your breath. Meditation-wise, when you are in this state, when you're sitting in asana for a prolonged period of time, you slowly enter into meditation. And I recommend people who has a peripheral neuropathy to sleep on a hard surface. Hard surface is even sleeping on a hardwood floor, which I do quite often for my back pain, if I have a back pain, or sleeping in a carpet, or have a very high, hard orthopedic mattress. The softer mattress are worst for your life. And during sleeping, also recommend people with peripheral neuropathy to wear this toe separator, sleep at night. My friend, who is a physician, who had a peripheral neuropathy and were not responding to any medication and tired of taking medication, when I recommended to him, he had a very difficult time initially to even put this thing on and even to sleep, but essentially he got better, started feeling it, started sleeping with it. As again, as I say, the yoga therapy is purely experiential. It is let go. You cannot tell anybody to do a yoga therapy practice. Famous philosopher Carl Jung said, if you resist, it persists. Trying not to have a stress will give you more stress. Trying not to do this thing will backfire on you. Trying to do it triangle pose, Trikonasana. It's going to hurt you. Stay in the Trikonasana, close your eyes, continue breathing, breathing out longer than breathing in. It will let go and Trikonasana will come to you. As simple as it is. So again, we're coming to a closure of your time. We have shown you wonderful practices for peripheral neuropathy. If you have any questions, comments, put your Facebook and I'll be glad to answer them. Again, if I'm in town, I will be here with you. I do have a couple of programs coming up. One is coming on August 20th. It should be here locally. It is a yoga therapy for health and wellness. It is a local organization who've been arranging it. So thank you for joining today. And next, I think what, July 29th, probably I'm here. So I'll post it. And if you have any request for any kind of ailments or disease, please send it to me. I'll be glad to do it. And if you want to do it on this pattern of degenerative disease, aging disease, autoimmune disease, I'll be glad to do it at this time. See you soon.